Hello, good morning. This is Dr. Uvo Norebe. Today we're going to be having a meeting interview with Dr. Romesh Nalliah of the University of Michigan. And looking forward to having all of us learn. If you have any questions that you want to ask, welcome, Dr. Romesh. I see you. We're going to get started here. If you have any questions, I want you to write your questions down or type them. Dr. Moyo is going to be our moderator today, so she's going to help us make sure that all the questions that you ask are answered. Good morning, sir.
Hi, how are you?
I'm fine, thank you. So I want to. We're just going to get started. We have a short time today to cover a lot of material. But Dr. Romesh, I just want you to introduce yourself. One thing I want to say is that you are a foreign trained dentist who is in leadership in dental education in Nigeria. So you are someone many foreign trained dentists look up to. They look at your LinkedIn profile and they're like, wow. How did you do this? How did you come from Australia as a foreign trained dentist, and right now, tomorrow I'm just a prophet here. I think you're going to be dean of a dental school or something. Anyway, that's just my own, but it looks good. Everybody's trying to build their CV, and when we look at you, we look up to you for real. Many people look at you and they're like, wow, but they are here kind of locked down with their certificates on their training, and they're wondering, can I become something in the United States? Dr. Romesh, I want you to take it away. Just tell us how you became a practicing dentist who is in leadership in dental education in the United States.
Well, thanks very much for those kind words. But you know this, Uvo, like nothing is accomplished alone, and I've been blessed that many people have been brought into my life that have given me opportunities and blessed me, and so I'm fortunate, and it's because of them that I'm here in this position now. And actually it's because of I'm a religious person, and it's because, like, I think God has blessed me in this way. I feel a real burden to help other people, because who is going to be there to help the next person, like there were people to help me in my path over the last 15 years. So I guess my background is that I am a foreign trained dentist. I was actually born in Sri Lanka, but there was a civil war in Sri Lanka, so my family moved to Australia when I was about 5, and I lived in Australia from 5 till 30, and I plan to live there forever. But I met this lady, and she was American, and we did live in Australia for a little while, but then it's she's part of a very big family, and everything pointed to we should move to the United States. So that's why I moved to the United States. When I was first here, I wanted to be in the dental field, but of course I couldn't practice. So the first job that I got was teaching dental assistants, and I think it was $15.90 an hour. It was in downtown Chicago, and that was a kind of a difficult time, and everyone goes through that period. And then I was fortunate to be able to go to Harvard School of Dental Medicine, and then I was faculty there for many years, for 8 years, and then I had this opportunity at Michigan, and so that's really it in a nutshell. But like I said, zero was accomplished by me alone. The right people came into my life at the right time. And I think that's part of this process, Uwe, that you're interested in and I'm interested in, is to be that person for someone else, is to provide resources, provide knowledge, and just open doors for other people. So that's why, we both do what we do.
Mm-hmm. I'm going to dig into a little bit of some specifics. So most people are wondering. So you came in and you did have an opportunity to teach in a dental assistant school. Then what exact program did you do, and how did you get licensure?
Oh yeah, I came 2007, and actually back then, I don't know how things are now, but back then the state of Minnesota would accept people on a one-on-one basis. So they would evaluate your CV, they would evaluate your curriculum and accept people or reject them on a one-on-one basis, as opposed to most states have like, you know, everyone has to do these 3 things or whatever. And so I was fortunate to be accepted there, and I was actually going to practice there, but then I was offered a position as faculty at Harvard. And so I did not pursue that. In Australia too, I was doing some of my time in academia and some of my time in private practice. And so I knew that I wanted to have engagement with academia, and the Harvard position was 2 days practicing and 3 days in academia. And so that really fit me really well. So then I started that position.
Okay, one more question. So you did a program, you know, I know you did a master's at at Harvard University. Was that before you started teaching there?
No, that was after. That was after, because what happened is, in Australia and at Harvard, I just had a lot of passion for public health, and I was willing to get my hands dirty and do a lot of work. But I started to realize that to impact the most people, you need to be skillful at administration. You know, I was very interested in direct care. I was very good at getting volunteers to help me and go and do projects. But to really make an impact, you have to understand administration, and you have to change legislation, and you have to change processes, and you have to negotiate with insurances. And that's the way you. And then I got the opportunity here at Michigan to be in an administrative role that manages, you know, patient care. And so that's sort of a marriage of my interest in public health and my clinical training.
You know, and I see you're also editor of a dental publication. So, you know, how, you know, I know this is not part of what we're discussing, but how did you get into that?
Oh, you know, at Harvard, if you don't publish papers, you get shot dead. And I had an awesome mentor, because I told him this has not really been my thing. And he said, what are you talking about? Your work is your research. And he's a great mentor. His name's Nadeem Karambuks. He's now the dean at Tufts. And he said, you're not asking you to, you know, go and measure cells and, you know, empty test tubes, because that's what I thought research was. And he said, your work is your research. You're interested in public health? Okay, that's your research. And so now, like all of my research, there is a reason that I did that work, and it's connected to my day job, you know. So that's the thing that I would say is the best advice that because I never it never felt like an obligation to do research. It was truly just measuring the outcomes of the interventions I was trying to do. Are these things working? Are they not working? Yeah, your work is your research.
Okay, nice. I mean, guys, if you are listening, I want you to go. If you want to get more information about it, go to the link on our bio. You just type in there. You'll see a Telegram group where we're going to be sharing some information. Today, Dr. Romesh is going to talk about. They did some work. People have been wondering, you know, what are the pathways? How do I become a dentist? That's the question everybody is asking. And you know, Dr. Romesh, I'm just going to just allow you just take it away in terms of what you have done, what you have found, and how we can help our listeners who are from around the world, from Nigeria, from Egypt, from Ethiopia, all the way to Rwanda and Iraq. You know, people are there listening, wondering how some folks are already in the United States. Can you just tell us about what you have found? And if you would please just talk a little bit about your Synergy program and just take it away from there and how you got your paper published.
Okay, yeah. So one of the things is this was true 15 years ago when I was going through the process. It's still true. There's not a lot of transparency in this process. It's hard for people to know what makes me successful, like in entering a program, and what makes me unsuccessful. It's hard to know what does the school actually want. You know, there's the process for the regular DDS program, DMD DDS program, going from first year to fourth year, has a lot more transparency and information. And we also ask more information of the applicant. Like we ask about their family history, household income, and all these things, because we want to consider that in making these decisions. And it's not quite the same for international dentists program. That process has not matured yet, I think. And so it can be very lonely and confusing. And there's a lot of conversation in Student Doctor and other blogs and different stuff like that. And sometimes I read that and it's crazy misinformation, and people are going to waste time and money pursuing things that actually we in academia don't value. So they do these things and then they apply, and then I read their application. I'm like, we don't care about all this stuff that, you know, we care about certain things, but there's not great transparency about what those things are. And so that's why with that and with the burden of, you know, I've been blessed, I want to bless people, we started this Synergy program. And Synergy used to be an in-person program before the pandemic, and I would take 10 people a year. But then what happened is the pandemic hit, and I was very busy with my job because I'm the Dean for Patient Services. I forgot all about Synergy, but then people started emailing me, 10 people, 20 people, 30 people. And so then I thought, why don't I just do something online? And, you know, just to give some information. It won't be the same as, you know, in person. But I think we had 230 people come to that first session. So and that's because there's such a void in information. And when we said we're going to give some information about that process, everyone was interested. And so anyway, so that program, we run it every January and June. The next one is June 5th. And our website is synergydentist.org. You can get to it from the University of Michigan website, but that's the link is synergydentist.org, and it has the registration links and all that stuff.
Okay, I'm going to put that link on my bio. If you click on the link tree later today, I'm going to put that link there, because, you know, if you are looking for information, you just go there. And what does the Synergy, what does it entail? How many hours of online you know, meeting do you have with the people that attend?
Yeah, it's about 4 to 5 hours. And there's another woman that I collaborate a lot with in this kind of research with to do with foreign trained dentists. And so she usually co-presents with me.
Okay.
And one of the things we talk about is, you know, how to strengthen your CV and personal statement. And, you know, it's my feeling that 75% of applicants, they just need to be pointed in the right direction. They're excellent applicants. They don't need like a whole revamp of their CV and all that. So we couldn't do that online anyway. So we just provide some general information, point people in the right direction, a few little tips and tricks that people sometimes wouldn't know, that we try to inform them of that. And then we have some practice interviews. And then sometimes I try and have a special session, like I have someone come and give a lecture about, you know, we've had someone give a lecture about the US health system. We've had someone give a lecture about mindfulness. Because honestly, like, this is a very stressful process, actually. I remember it. And so you know, we try to serve people with what they need with that last hour, bringing in someone to speak and, you know, do different things like that. But the core thing is some advice about personal statements, CVs, and then practice interviews.
Okay, you know, like I said again, I'm going to put that link on my link tree link on my bio. So later you can come back later this afternoon. That link is going to be there. I think the registration. You're telling me that the registration link is active right now.
Yeah. So there's like 4 different places that on our website that you can register, and there was one that I couldn't figure out how to change, but most of them have been updated to the new.
Okay, all right. Yeah. That is fine. Okay, so please go ahead with the work. So with the work you have done, you know, what have we found? Why, you know, some people apply several times. Like, I know folks in Canada, you know, most of them are coming back to the United States to get there because it's so difficult. You know, most people tell me they came in and they're still working odd jobs for years, and people are tired.
Yeah. Uwe, that honestly is the day that I thought I've got to do this program. I remember I was in Boston, and like I said, I've been fortunate to have certain doors open to me, and I was running a CE course on some clinical thing. I can't remember. But I was sort of doing your role. Like, I was the facilitator, moderator, and I had a couple of experts. And then there were these 3 women that I went and spoke to, and they had some terrific questions. And I was like, where do you practice? And they said, no, we don't practice. We're dental assistants. And I'm like, how can you know so much? Not that dental assistants don't know anything, but they knew like difficult clinical scenarios. And I was like, how do you know this? And they said, well, we're dentists from another country. And I was like, my goodness, tell me more. They had tried 6, 7, 8 cycles, you know? And so I said, what can I do? Can I help you somehow, you know? and they sent me their CVs and personal statements, and it was just really different from what we anticipate as Americans. You know, really, really different, and it's just a cultural difference. And so I just, you know, talked to them a little bit, and honestly, two of them were so far along in their careers, they weren't looking to become dentists anymore. But the other person did some of the things, and she might have had one more failed cycle, but then she eventually got in, which was great. And then I thought maybe we can help other people here, and so that's when we sort of started the program. But anyway, I went right off topic and forgot your question.
No. So you know that's just fine. In terms of, so what have you found out from your research in the
Excuse me. So we have a number of publications because we want to create information where there has been a void. So we have one paper talking about all the different observerships available in America. You know, and for the record, you don't have to do an observership to get into dental, into international dental program. And if we have time, I can talk about that. We definitely cover that in Synergy. The other thing is, so one paper on observerships, another paper on all the different pathways to licensure, because I found that a lot of people think there's only licensure through advanced standing, but there's multiple pathways, and they're not good for everybody, and you'll be probably more unsuccessful if it's not a good fit. But for the right person, a different pathway may be even more appropriate and more successful. You know, so that's another one. And then most recently, we did this paper comparing people who are unsuccessful versus people who are successful, because I wanted to sort of start to call out what are those differences. And so what I did is, on our Synergy website, I put a survey saying, you know, if you have not been successful yet in getting into an international program, please fill out this survey, right? And then I gave the exact same survey to my students here at Michigan, my international students.
Okay.
And then I was able to compare the two groups, and it was there was a lot of expected things, but there was a lot of unexpected things. So if I have time, Uvo, should I just zip through? You can stop. You can interrupt me.
Go ahead. No. That is why we're here. That's why we're here today. You know, go ahead.
So one of the things I asked is, where were you when you applied? Okay, and the people who were successful, like 99%, lived in America, but the people who were unsuccessful were applying from other countries. And we can talk more about that, but it's not necessarily that, you know, we're favoring people in America. But the thing is, you cannot demonstrate certain things in your CV if you're living in another country.
Yes.
There's some of the things that you got to show that, number one, you can handle the academic rigor of a US dental program. Number two, you have some understanding of dentistry in America. It's really hard to demonstrate these things if you live in another country. So that was the first thing that we found.
Just wanted to add here, I mean, there are some programs that require only green card holders or US citizens. So there's no way you can get into that school or those programs if you are not here. So I mean, so that is on the far end of it anyway. But someone who has visited, who knows exactly what to expect, who is conversant with just using the computers, electronic, just electronic data or patient data, just understanding little things like that.
Right.
Obviously, I think will stand a chance better than someone who's just coming. But that's not saying that someone cannot get, you have to come into the United States to take the exams. Because most schools are requiring you to pass the INDB before you apply. So if you are not here, then you cannot take the exam. So coming here, obviously, you're right. I think you have found that is very correct.
Yeah.
Go ahead, sir.
So another thing I asked is, have you spent $30,000 or more on strengthening your CV? Now, I didn't have that kind of money, right? But now things have become much more competitive since 2007 when I came. And so what I found is that only about 10% of people who were unsuccessful had spent more than $30,000. But about 1/3 of people, about 33% who were successful, had spent more than $30,000, right? And actually, let me zip through a couple of things because I think they tie together. Because the next thing I asked was household income. People with a much higher household income were definitely getting into programs. People with lower household income were less successful. Then I asked how many failed cycles, right? And very, very few people who had 0 cycles got into a program.
Mm-hmm.
But most people had 1 or 2 or more failed cycles. So the people with 0 failed cycles, they had a failed cycle, right? So it's very, very tough to get in first time. And part of that is, I'll just tell you this, you know, for the regular DMD-DDS program in America, the acceptance rate is about 55%. So 55 of every 100 get accepted. For international, it's about 23%.
Wow. So it's few, yeah.
It's half, right? So there's a lot of really good candidates that miss out just because it's super competitive. There's not enough places open. So next I asked about additional degrees like masters, PhD, specialty degrees, additional degrees gained in your home country, and there was no difference in the two groups. Then I asked, what about differences? What about additional degrees gained in America? And so now the group that were accepted were much more likely to have a degree. And I'll tell you, as someone who's been on admissions, one of the things is, you know, we see these foreign degrees, and I know that they go through the credentialing companies and all that, but honestly, you cannot really understand. Okay, so I've been in this long enough that I know certain countries, they just grade their students really, really hard. And so like the top student will get a 3.0. And you don't know that until you've been in the business for like 15 years. So those things are really confusing. But what happens is when you do a degree in America, they see the GPA, and then I know that school. I think, okay, they went to a good school.
Yeah.
They got a 3.6. This student has got something, right? And so that builds their relevance. And so getting a US degree seemed to really help. And the last thing I ask is, what about your age? How old are you? And the older people were much more likely to be successful. Okay, so now let's tie these things together. Okay, so it was people who spent more money, people who had had more failed cycles, so they've been in America longer, and then people who are older, who potentially have been in America longer, right? So when you tie these things together, one thing that I would say that is connected, I think there's multiple things. I think having a higher income seems to be a factor, but another thing I think is a better understanding of US culture, okay? Because sometimes that's the thing that I saw all those years ago in those CVs. I saw these CVs and I was like, why you got this stuff in here? But it's a cultural difference, right? So just one quick example. One of the women was an amazing academic. She had every failed grant that she'd ever had. We never do that, American academics, you know? Like she had 2 successful grants and she had like 38 failed grants. I'm like, why do you have this? It makes you look bad. But that was a cultural difference, you know? So, so this American culture, and I don't want to get too crazy here, but we do cover this in Synergy. I hope this is not confusing, but you know, there's this thing called high context culture and then low context culture. Okay, a low context culture is America, Australia, and this is why I'm lucky, because I was born in Sri Lanka, which is a high context culture. I moved to Australia, and now I have a cultural advantage when I apply in America, right? It's not fair. So other people who are born same year, same hospital as me, but they never left Sri Lanka, they have this cultural disadvantage, okay? So low context culture, which is Australia, America, England, it is very direct, okay? You're thirsty? Uva, I need a cup of water. Okay, that's America, Australia, okay? Now, Nigeria, Sri Lanka, these other countries are high context. So they'll say, hey, listen, my mouth is dry. I had a long day. I've been so busy. I had a long day. I think I forgot my water bottle today. So you've got to read between the lines and say, do you want a cup of water? Right? But see, these cultural differences are a big problem in an application, in an interview. I find that high context culture people feel uncomfortable speaking highly about themselves. Right? And when they try and do it, they do it in such an awkward way that it sounds arrogant. Right? So these cultural differences, it's unfair. Like it shouldn't be the reason that keeps you at dental school, but this is the environment in which you must succeed. Right? So you have to pay attention to these differences. That's why I say, you know, you can do an observership, but what about if you work as a dental assistant and just be very mindful of everything that's going on? It's not just, I'm not just there to hold suction and fill out a few hours. How is the doctor interacting with the patient? Is that different to me when I was in practice? Right? How is the front desk interacting with the doctor? How is the front desk interacting with the patient? So you have to be very mindful and absorb everything. And this can, I think, help you fast track that learning of US culture. You don't have to do an observership, but in an observership, you get these opportunities again to observe interactions and observe US culture and different things like that. But I think people who have been here longer, people who have had failed cycles, People who've spent more money, which means they're more established in America, they have more money to spend. They all have the advantage that they've been engaged in the US culture longer.
Right.
That's
You're
made
right.
them successful.
You know, I think, being here also, back in Nigeria, I think the Nigerians will understand what I'm going to say now. It's called Uno Man, Uno Man. Your face is in the door. They recognize you. I mean, there are folks who have been taking, I know someone who has been in the school, came to visit for a day. There was a job in the faculty. He took the job cleaning. I mean, this guy is a dentist now because he stayed there, and all of a sudden, he had friends. He understood. He could relate with people. He understood. And he wasn't like, usually we are very, oh, sir, bow down without looking at people in the eyes. You can look at people when you shake their hands, look at them straight in the eye.
Yeah.
Don't be a coward, because if you're a coward, they're like, oh, this guy is not going to be able to make it. Because with your patients, you have to be able to talk directly. You're talking to patients who research stuff. You are coming from Africa, where patients didn't necessarily, they think the doctor is a king. But here, people have access to information. They've researched the procedure. You should be able to explain, talk, and work as a team. All the things coming to talking about an extra degree. I think if instead of waiting and waiting, get yourself some US education. Obviously, that's going to make you spend more money, which is, if you follow this paper, you are going to get accepted. Because someone, when I went for my interview, they said, oh, he has an MPH. Oh, he has a residence in dental public health. So I'm already used to this stuff. I've presented papers. They're like, oh, come on, we want you in our program. I was taken in several places just because of that. But if I didn't have that, there's no way. My GPA from University of Benin was very poor, because that's the way the grading is over there. So when we do the conversion, you don't even stand a chance, because some other schools give really high scores. So, but having a US, you have just explained my own life as you're talking now. My extra degree, I came into the school, I knew a lot of people there. So when I was coming for the interview, they're like, oh, we know this guy, and that's the way it was. I'd done a residence in dental public health. So when I came into the interview, I saw somebody whom I saw at the National Oral Health Conference. Oh, it's like, what are you doing here? I'm coming for an interview. Oh, you'll be taken. He had nothing to do with the admissions, but it's like, Uvo, come on, and I was taken.
But this is important point, Uvo. This is an important point. Public health is in your heart. I know that because I know you, right? Don't do a degree for the sake of doing a degree, because I've met students who have done a degree in an area they are already expert in because they want to get a high GPA. That's a waste of time. Mm-hmm. Because you've got to tell your story. What happens is when you interview, when you write your personal statement, when you interview, there has to be a thread of connection for all the things you do. For me, it's public health. I could easily tell from the day that I started dental school till now, it's always been public health. And same with Uvo. Now, if you start doing these crazy different things, it's harder to tie that together. So just be authentic. I don't think people do this enough. When you're about to start this application process, spend some time in reflection. Ask your partner, what do you think of me? Right? That could be dangerous.
Who am I when nobody's looking?
Exactly. Because it has to be a self-reflective process, that when you present yourself outward, there has to be authenticity there.
You're right.
I didn't do this master's to get a high grade. I did this because my passion is public health, right? And so then that's very powerful. And then it's super easy to write a personal statement. It's super easy to answer interview questions, because you're just being you. You don't need to be pretending to be someone else and all that kind of thing.
You're right. I'd done medical missions to about 11 countries before I came to the United States. So when I said I'm a public health person, it was easy for me to write my statement. My statement was about a patient I saw in Burundi. That's what I wrote about. How I found a patient with cancrum oris, and how I helped her, and how I want to be a dentist in your program so that I can help more people. That's all I wrote about. And the guy was like, we want you. Next week, in 2 weeks' time, I'm going to Kenya. So I've not changed. I'm still the same guy. I'm still going to all these countries. So it's who you are. If you speak about yourself, I know some people are trying to embellish their CVs so that it looks like, but they're going to ask you one question that will prove whether or not what you have written is reflective of the truth. So do you have a sample CV on your website that people can just take a look at?
I don't, but this is one of the things that we cover is how do you structure a CV? How do you structure a personal statement? Because the thing is, sometimes people feel like they should write everything. They feel like it's like their obituary. They want to write everything that's important to them. But, I don't think it is that. This is just an essay to get an interview, right? And it's important, what you said, I want to reiterate, don't embellish stuff. Don't exaggerate stuff, because an experienced interviewer will figure that out, and then you're not going to get in. If there's a discrepancy between what they're reading and what they're meeting, that's not going to go well for you. See, this is another thing, Uwe, and I don't know much about Nigeria, but a lot of Southeast Asian countries, including the one that I was born in, there is a highly regarded and accepted way to do things. Like go to university, get married, have a kid, start a practice, blah, blah, blah. So the thing is, in those countries, following the rules is highly valued. In America, uniqueness is valued. People often ask me, hey, Romesh, what should I say to get an interview? No. Who are you? What do you bring to the table? What's unique about you? We don't care about the rules. In fact, the person that followed the rules, they're just going to be some suburban dentist not doing anything. They're not going to be Uvo. They're not going to make a big difference, right? We want an Uvo. We want someone who's going to be unique, who is, we can hold up and say, that's our graduate. We're proud of that person, And so in this country, uniqueness is valued, whereas in some of those other Eastern cultures, following the rules is valued. It's a big difference.
I did talk with someone here. I don't know if she's here right now, Dr. Maria. Dr. Maria, if you are there, I'm going to try to see if I can. Dr. Maria just joined. I'm sending you an invite. This is putting her on the spot. But she just saw me. We just started talking like 3 days ago, and she's here right now. And she's schooled in Venezuela, in Colombia, and in Spain. And she wants to get into the United States as a practicing dentist. And she sent me, her CV was in Spanish. So she has converted it. And I want you to ask a question here about CV, because this is like real life. She has sent me a copy of that CV. And I think, by the way, you should attend Synergy, because this is going to be treatable. Go ahead.
Okay. Hi, how are you?
Hello.
How are you?
I'm good.
Nice to meet you. Yeah, I was talking with Dr. Uwe because I was wonder how to make my CV from Spanish to English, and because I have a long experience in clinical, in the practice private, because I used to work in Venezuela. Then I did my specialty in Colombia. I worked in Colombia, and then I got my license as a prosthodontist in Spain. So I think that I have a lot of experience, but then when you got here, you don't know how to start, or where to start, or who can you talk to. And I don't have any volunteer or any observership here. So that is a concern for us, because all the time you hear that people, you need to do a volunteer here, you need to make a observership here, you need to study this, and it's a lot of information. Sometimes you got like, oh my God, I'm going to get crazy.
I'm going to just jump in here. So she told me about her CV. I said, your CV is in Spanish. You've converted it to English. I think it's enough. You don't need to put, this is who you are. This is what you have done. So, but Dr. Romesh, what would you say?
Yes, I agree with Uvo. Like, the CV is important, and there are things you can do to refine it, like, take out unnecessary information, provide some information when it's something that's not commonly understood. There's a few little refining things, but actually what's more important to me is the personal statement. The reason is your CV could say any crazy thing if the personal statement brings it together into one authentic person, right? So the personal statement is that's what's important. Like Uwe says, your CV, that's you, that's your life, right? And you can do a little bit of tweaking, but the personal statement is like, okay, you've done all these things that seem unrelated and disparate. Why do they come together? Like, why did you do this one thing over here, but then this different thing over here? So that's your opportunity to explain the different experiences that you've had, you know, and that's where the power is. And that's where you take control of your application. I mean, your CV is your CV, but your personal statement, you get to describe why you did all these different things and to some degree what you want to do in the future. So if there's some consistency that you can show, I'll try and explain this real quick with myself, okay? So the first study that I did, I think that was a dental study, right? But then the second study that I did was actually childhood poisoning, okay? And then the third study that I did was sports injuries, okay? And then the fourth one was something else, and the fifth one was dentistry again. The thing is, I was working on a big database, like 50 million patients, a hospital data set. And it was too interesting to look at all this other stuff. I didn't want to just do dentistry, right? And so I was criticized all those years, but now people look back and say, oh, he's a big data expert, right? So the thing is, you have to keep doing what you're passionate about, because I don't know, and Uwe doesn't know, but you know why you did all of those things. And that's what has to come out in the personal statement. I did these things for this reason, and that reason makes me me, you know? So to the reader, the CV may seem disconnected, but that's where you bring the connection in the personal statement.
Okay.
All right.
Perfect.
You've gotten some gold out of Dr. Romesh right now, because you were focusing on CV. I was trying to tell her, it's not, but now this is the answer, your personal statement. We're going to talk later. So sometimes we'll get an opportunity to do some one-on-one. So looking forward to talking more and seeing how you're going to put your personal statement together. But anyway, congratulations for coming online and putting your face up.
Yeah, I was looking forward.
All right.
Thank you so much. Bye.
Bye.
Bye. All right. So the last thing here, I'm going to Dr. Romesh. I want to talk about opportunities that foreign trained dentists can have without even going to school, without having to get a license. In terms of, I don't know, are there faculty positions that foreign trained who live in America can access?
Yeah, but it's only for the right person, because if you want to be in private practice and that's where your heart is,
yes, and
then you go through a faculty pathway to become to get some academic thing, you're going to hate your life, and it's not really worth it, So some of these things we will cover in the Synergy program where we have more time, and we've published papers on all the different pathways, because I can't remember, there's like 7, 8, 9 pathways, and a lot of people think there's one, but there's a bunch of pathways. But it's got to be for the right person for the right reasons. Otherwise, it leads to a lot of frustration and disappointment. There are academic licenses in some states. It's complex. America is complex, right? So not every state accepts it. So the board of every state doesn't accept it. So there might be like 30 or 40 boards that say, yeah, you can have a foreign license and be an academic. Now, then you come to the schools. Not every school accepts it, even if their state accepts it. So then it comes down to maybe there's like 25 schools in states that allow an academic license. Academic license, by the way, means you can practice within the school while you have a job.
Okay.
If you're no longer an academic, you no longer have a license. It's linked to your job and it's linked to the building that you work in.
I see.
Right? And these positions are getting more competitive because now, I suppose in the old days, a lot of people use this pathway and they just thought, let me just get some kind of a job in America, whether I'm teaching or practicing, whatever. But now it's genuine academics that are applying for this pathway. So people with 20, 30 publications and grants.
You're right. So are there positions, Dr. Lagric, I don't know if I'm getting your name right, but it's good to see you, Dr. Lagrisa. Good to see you. Thank you so much. I know she does a lot of work also in terms of holding a boot camp for international dentists. There are so many programs. People are willing to help. You need to come. We're going to try to put some of this information on our site so that you can access it. For me, I just want to drag somebody's asking me the other day, why are you doing this? What's wrong? Why? Somebody asked me why. I'm like, we have been through this. The fact that I cried when I came here, it does not mean you should cry. Because we have found a way. I mean, you can show somebody else as well. Once you find a way, let somebody else in, and I think everybody's going to be fine at the end of the day. The sky is big enough. America needs dentists. In terms of need, I've been working somewhere just part-time, and we've not been able to find a dentist for 6 months. I just finally told them, I can't help anymore. You guys have to find somebody. I don't know why, but there's a need for dentists. So the foreign trained dentist is an asset to America. There's rural America. There are rural places in this country that people who live here don't want to go, and there's a need. People that, the rates of caries, periodontal disease and all that stuff is still going on. And, Dr. Romesh, have you done any research on, linking, primary care to dental care?
Only that, one of my areas of research is looking at surgical procedures, medical surgical procedures, and then measuring what happens when there is concurrent dental disease.
Okay.
And always we find that the infection rate is higher, the length of stay is longer, the cost of care is longer. So, yeah, that's what we've done in the connection of medicine and dentistry.
Okay. I have a question here. She says she wants to do an MPH she wants to do an MPH, but she wants to take the INDB exam before. You say, what are your thoughts that, if she wants to do an MPH, but she wants to take INDB exams before she enters the program so that she can, my question would be, why do you want to do an MPH, right? Because you're trying to you want to get into dental school. Obviously, she believes, for you to do it, how do you get into the United States is a problem. So how do you answer folks? How do people come into the United States to take the exams?
I don't know how to answer these visa questions, man, because, I married an American, so things were easy for me. So I don't know all those visa things. I know it's very challenging. And one of the ways to enter America is doing a graduate program like an MPH. There are restrictions with that people should know about, like you can only work, 18 or 20 hours. And so sometimes if you don't have some wealth to bring with you, it's difficult to pay the bills with the job that you have. And then remember, if you're limited to 20 hours, then what about, working as a dental assistant or volunteering as a dental assistant? Like, if you go to a practice and say, hey, I can work 20 hours, some of those practices want someone full time. So it can be a disadvantage to have that kind of visa when you're trying to build your CV for school. But the question about the MPH, like Uvo said, that's not a question someone outside can answer. It's really, is this MPH, I guess I'd ask you to think about this, is this MPH to strengthen my application, or is this MPH for my future? And I think if you answer the latter, then go ahead and do the MPH, find time for it. And do it, because if public health is going to be a part of your future, it's probably better to do it now than afterwards, because number one, it'll have the additional benefit of, it probably will help you strengthen your application to dental school. And then after that, once you become a dental student and then a dentist, you don't have time. Life is going to get busy. So now is the best time to do an MPH if that's part of your life goal.
So apart from so someone who is interested in material research, what opportunities do they have in terms of what additional degree can they get in terms of if they are pursuing, if they want to become an academic pursuing dental material research, what can they do? So
real tough question. There are now, and it's because dental school is so competitive, right? There are now programs, University of Michigan has one, which is basically a Master of Science, a Master in Dental Science or something like that. I forget what it's called. At our school, Dr. Elisabetta Karl runs that program. And so there's some coursework, but you can also engage in research. And when you're, for example, at Michigan, sorry, I only know the Michigan example. If you're here at Michigan, Dr. Peter Ma is a globally renowned dental materials researcher. And so potentially you could work for him in his lab when you're here as doing that master's program. You could expand your skills by working with someone like that. But yeah, I mean, there's not a lot of schools that have this kind of a master's, which is truly to bridge the gap between college and dental school. But Michigan has one, and there might be, I think there's less than 10 across America. But those programs are great because you can do the program, do some coursework and learn a little bit about US dentistry and everything. But then also on the other side, you can do research because there's always a project that you have to do, and you can do research with one of the people. So I lecture in that program, and what I lecture about is how to prepare your personal statement and CV.
I see. Okay.
They're really trying to get you geared up to apply to dental school.
Okay. There's a question here. You said, Dr. Kumkum, she said, after graduating from dental clinic, I worked in my clinic. In this scenario, I don't have much publication. So how do I strengthen my CV? I guess it goes back. I'm going to allow you to answer the question, but I know you're talking about more of your personal statement, not necessarily your CV.
I'll give you the example of a young woman who, when she got into dental school, she was actually my research assistant, but she just started, like 2 months in, she got into dental school, okay? And she had 0 publications, but she was passionate about advocating for vulnerable patients. And in her hometown in America, she was volunteering for a cancer advocacy group. So this group would go to the state capitol and advocate with legislators, senators, health policy advisors, saying these are the funding mechanisms that we need to help treat and manage people with cancer. And so her whole personal statement was about that passion and how she would bring those skills to dentistry, because she wanted to advocate for vulnerable dental populations as well, and just hadn't had the opportunity to do that. And so she got in on the back of that advocacy experience and interest. So all to say, research is not the only thing that will get you in. Research is one easy way that separates you from others. See, because there's thousands of applicants, right? And so then if you look at, who has a publication, that's a smaller group. And, it just might make you more competitive. It's not a guarantee that you'll get in. And there's more ways than just research that help to set that tone of separating you from the bunch.
I know. There are a lot of people. I was looking at the numbers when you mentioned the numbers, and I want to go back to those numbers. You said for the regular dental program, it's 55%, while for the international dental, it's like 23%. So it's so it's a lot of people are applying. How many people apply every cycle in terms of how many positions are open and how many people apply?
This is in our paper. I forget actually, I might have a simple table that just shows it. It's in the paper that we just published. About 2,500 people apply. But here's the thing, depending on how much money you have, some people apply to 25 programs, right? But then how many applications does each school get? It can be a lot, because people are applying to multiple there's only 2,500, 3,000 people, but they're applying to multiple programs.
I see. All that's, you cannot just pick. Some people are lucky they pick only one school or 2 schools and they get in. But some folks, we've had to apply. I applied, like I was telling you, I applied to University of Minnesota. I went for the interview, and I was told that I wasn't wearing my glasses, so I didn't have one then. And the professor told me, he said, "Gentlemen, you need to go check your eyes," because I was doing a bench test and I was like, moving straight, and that was alone. That was the difference between night and day. Folks were using loupes to work. I came in with my shining eyes from Africa, and the guy was he said, "Dude, you are getting old. You need to get some glasses." I got my glasses. I got my glasses a year later, and I got multiple admissions. When I did, it was just the difference between night and day. I wasn't seeing properly, and I thought I was. And I went to the interview, and he told me, "You need to go get your eyes checked. You're not seeing. It's okay. It's okay to put on glasses. If you come back with your glasses, I'm sure you are going to do better in this test." This is not going to do with CV or anything. Just who you are. In terms of what, So I want you to just take it away. What last advice do you have? And just, if you could just recap the information about Synergy again. I'm going to be in Synergy with folks who are planning to attend. So please go ahead, sir.
Yes. so the website for Synergy, which has a fair bit of information, there's some free resources. There's a free resources page as well, but it's synergydentist.org. And so all the information and registration, all that stuff is there. But just in recapping, I think, I think authenticity is really important. A lot of people ask, what do I need to do to get in? I don't have that answer, okay? Because there is a unique path for everyone. And in dental schools, in America, in dental schools, we value uniqueness, right? We're not looking for another person that followed the rules. We're looking for someone who has done, unique and amazing things and wants to continue doing those things.
Yes,
like
yes.
Uber is a perfect example, So, uniqueness over rule following is be very careful. So actually, I want to share this one other data point. This is crazy to me. In my study, I found that people who were unsuccessful, more people who were unsuccessful strongly agreed that they had a mentor. Okay. The problem with this is people think they have a mentor. Okay. But is your mentor someone who just got into the program last year? That isn't a mentor. I mean, God bless them, but they have the experience of one, right? So you need someone who has a broader perspective on the profession. Perhaps a private practice dentist who is a part-time academic, an adjunct faculty, someone like that, or someone who's actually an academic, or someone who has, a significant history in America and has a broader perspective than, I got into an international program last year. So I thought it was very scary to think that more unsuccessful applicants thought they had a mentor than successful applicants, because I think you're misjudging your mentors. And we all know that there's so much information and misinformation on the websites. See, because there's a void, then a lot of things happen. There's, people try to fill that void with different things. Sometimes they're trying to make a bunch of money. Sometimes they're, trying to raise their profile or whatever. And, then there's some people like Uwe who are doing things for genuine reasons. So you got to find it. You got to use your critical thinking.
Yes.
And find out who those people are and pursue them and use their resources and their advice, and not everyone. And be careful of this, because that's what I found is more people that were unsuccessful said they had a mentor. So then what's your mentor doing for you?
Yes.
You have to be real about that.
You're right. Today as I was flying actually this morning from Texas. I was thinking about, I was watching the news. And I saw the migrant situation. 400,000 people are trying to cross from Colombia into Panama. And I started thinking, I think we should go out there and check, do some, check their oral health start. Just check. That's what I'm thinking. I'm thinking of going over to the across the border to do some work and do some research on how they are coming. How are their kids? What treatment do they need? What are their treatment needs? Dental, oral. I was just thinking about that. I mean, and it's just I'm working here. I'm a dentist already, but because I'm a public health guy, what I see on the news, it's like it never ends. Who you are will always come out. And I was just in Mexico across the border seeing those people, and I'm like, I know some of the needs that they have. I'm thinking, should we go there and help them? In terms of and do something and try to find a way for people to just stop by in this clinic. If you're trying to cross, we're not advocating for anybody crossing the border or anything, but there's a human crisis going on the other side. So whether you like it or not, people are there, people are suffering, and I mean, might just be an area that you might be interested in doing some research on. So everything you see every day, makes a difference. Thank you so much, Dr. Romesh. I know you are a very busy person. Thank you so much for joining us today. And we're going to put that link on my book. So if you go to my link tree by later in an hour's time, I will put the synergydentist.org link there. I want you to go there. There's also a Telegram group that you can join. So we're trying to gather all the foreign trained who want to come, who are looking for information, so that you can find some information. So this paper that he just published, I'm going to try to put it there so that you can read it. You need to read. I know people want to be told, what do I do? But you need to you need to read. You need to make up your mind from the information that is out there what you need to do to make yourself more presentable There's a question here. All of that is in the that last question. I think the answer is in the paper. So I'm going to put the paper on the group. Thank you so much, Dr. Romesh. I'm really thrilled to have you this morning.
Thank you, Dr. Uva. I appreciate your the opportunity to speak with you.
All right. Thank you. Have a wonderful day, sir.
Okay. Bye-bye.
All right.
Bye.
Okay, guys. We're going to be back on May 7th with Dr. The program director of the International Dentist Program at the Virginia Commonwealth University. He's going to be here on the 7th of May to tell us. We're going to ask him who are you taking in your program and what are the requirements, So that's going to be a very good one. It's coming up on the 7th of May. It's going to be on Zoom. That one is going to be on Zoom, so the registration link is going to be available on that site, on the Telegram groups. I want you guys share this video. This video is going to be available on YouTube. This video is going to be available on Instagram. But later today, we're going to upload it. Thank you guys for coming. I want you to go to the link on our bio. We are, and if you are interested in short-term trips, I did a lot of short-term trips, and that is how I embellish sort of my CV. I had been doing dental missions for years. So when I said I was doing that, it became easy. So we do have a mission coming up in Kenya in the next couple of weeks. If you want to be a part, some people, whatever you want to do, go to the bio, the link. There's a link on my bio that links to a Linktree account. You can look at all the different things there. And one of the things you can do to increase your accessibility is what you have done. If you have done some training, we're offering some dental implant training online, and we'll give you a certificate. And if it is, and this thing is being, given by U.S. trained, dentists, add it to your CV. It'll make a difference. So that implant course is a 4-week, 6-week course. Just go through it. Go take the course, and increase the chances. Because if you go there saying, okay, I've done a course, I have a certificate from a U.S. program. This is like the easiest one. It's not that expensive, and you can get that. Add that knowledge, because I know most of our schools, most of the people who if you train your school, I don't know how many people have access to great lectures in implants. So if you have 1 or 2 hours of lecture, that's not enough. So we're going to give you all the full lectures if you want to have that, and add that. So with that way, you can add that to your CV. You can add it to your experience. You can add it to the fact that you want to be an implant provider, in the future, and you want to get an American degree. So you find a way. One of these days, I'm going to talk about my own personal statement. So maybe sometime in May, look out for the poster. I'm going to talk about my personal statement. I'm going to put it out there. I'm going to go through section by section so that you can, you don't have to, so you can see the way I was thinking and how it was received. And so that is going to come up. So you have an implant course. We have a CV. Well, I'm going to talk about CV as well on that same day. Just put out the CV there, a typical CV, what it should entail, what should not be there. Your experience, your education, the school CV is pretty clean, but your personal statement is the goal. Just listening to Dr. Romesh talk. But thank you guys for joining us today. It's been good having you. Let's send me a message if you want any specific information. We're going to have mentors for you as we go along. You guys have a wonderful day.